Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to diagnose frozen shoulder, and I will go over the 3 key signs that you should not ignore that's indicated that you might have frozen shoulder. So before I go over how to diagnose frozen shoulder, we need to understand what is frozen shoulder. So frozen shoulder is the technical term for it is adhesive capsulitis. So as you can see here in this image, this is the joint capsule, the shoulder joint capsule. You have the scapula here and you have the humerus bone here, and this is the area that usually you might have frozen shoulder, adhesive capsulitis. So this is a capsule that attach the humerus head to the scapula, and when you have frozen shoulder, you start to have fibrotic tissue thickening in this area of the capsule that prevent the range of motion. So I can show it to you here in this model. So you have the humerus head here, and you have the scapula here, and this is the capsule that attach the humerus head to the scapula. When someone has frozen shoulder, they usually have adhesion, fibrotic tissue, inflammation in this area, so it limits the movement of the humerus head. So it's basically, to simplify it, frozen shoulder, it's like you are wearing a t-shirt, and that t-shirt 2 to 3 size too small, so it will prevent the movement of the shoulder because that t-shirt is kind of like holding all the bone together without allowing movement in the humerus bone. So by definition, at adhesive capsulitis, you will start to have a stiffness, thickening in the capsule here, and you see the fibrotic tissue. Also, you will have limited range of motion, and these are the signs that actually you need to pay attention to it because they are very classic for frozen shoulder, the limited range of motion, and I will go over that in the next slide. But you can see here, when your shoulder capsule is normal, it's look like nice and smooth like here. When you start to have adhesive capsulitis or frozen shoulder, you start to have inflammation, fibrotic tissue, so you start to have those thickening of the capsule here in this area, and that's what prevents the humerus head from moving. So limited range of motion of your shoulder, this is very classic signs and symptoms for frozen shoulder, and that's one of the way we diagnose it in clinical setting, by limited range of motion of abduction. So what is abduction? Abduction, when you have your arm to the side and move it to the side like this. So my palm up like this, and out here, my palm up here and out here, and I'm showing to you abduction going upward to the side like this. So the first sign, you're actually gonna have limitation of the abduction range of motion, which is this motion. The second sign is flexion range of motion limitation. So this flexion, so thumb up like this and bring my arm up all the way. So the third sign is limited of external rotation. External rotation, when you have your arm 90 degrees like this, and you bring your palm back, the dorsal part of your palm back this way, that's external rotation. So this is very classic for frozen shoulder, that you have limitation for abduction. You start to have limited range of motion for abduction. You will not be able to go up as far as you can in this direction. Then you will not be able to go as far as you can in this direction, and you have limitation in external rotation. So the combination of those 3 limitations help us to diagnose frozen shoulder. I will leave a link underneath this video for how to fix frozen shoulder naturally. The 3 powerful treatments that you have never heard of that actually naturally relieve or fix frozen shoulder. If you have any comment or question, leave it in the comment section below and I will answer it in the future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.